Inequities in Arthritis Care in Canada, the Black, Indigenous, and Person of Color Experience. My name is Ellen Wang, and I'm honored to present on behalf of Arthritis Consumer Experts. And presented here is our poster. Individuals that belong to ethnic minority groups are at greater risk for developing different forms of arthritis and often experience poor health outcomes. These differences do not occur by chance, and instead, a history of colonization, discrimination, and racism have led to systems and structures that reinforce health inequities. Thus, this survey aimed to identify observable disparities in access to and benefit from healthcare services between Black, Indigenous, and Person of Color, and white respondents. ACE conducted a 33-question online survey in partnership with Research Co. The English and French surveys were distributed via email lists through the Arthritis Community Network, social media, and Research Co panels. Respondents living with arthritis answered a variety of different questions. Data were analyzed in subgroups and aggregate. Chi-square tests were used to test for associations. We received a total of 1,249 responses. 317 were from BIPOC, 932 were from white. 732 of our respondents identified as women, while 484 identified as men and 16 as non-binary. Compared to white respondents, BIPOC reported greater barriers to accessing care, including time, travel, previous unpleasant experiences, language, and competing priorities. When Indigenous peoples were asked if their healthcare provider included traditional medicines or practices, 51% responded yes. BIPOC preferred healthcare providers with the same racial and ethnic background, gender, and generation. Overall, interactions with healthcare providers were rated less favorably by BIPOC respondents. BIPOC respondents were 6 times as likely to report having experienced ethnicity-based discrimination often. These results were even more profound for Indigenous peoples who reported discrimination based on ethnicity, gender, and sexual orientation. Our survey found that BIPOC respondents face significantly greater barriers when accessing arthritis care, and when they do, benefit less from their interactions. The data reinforce our understanding of environmental barriers and patient preferences that necessitate tailored solution. We call on all Canadians and all levels of the healthcare system to join forces to dismantle the unequitable structures that exist.